Good afternoon. This is Sarah with the Department of Medicaid. It's not quite 2 o'clock and we are still clearing out the waiting room. We'll give it just a minute before we get started.
Hey guys, sorry, I didn't mean to run quite so close. Guys, it's 2 o'clock. Should we go ahead and get started?
I was just unmuting to let you know that the waiting room is clear. I
Okay.
only have the three of you logged in unless I'm, excuse me, unless I miss somebody. I don't think I did. So if you would like to go ahead and start, you do not currently have a quorum, but I can let you know if someone joins.
Is 4 a quorum for us?
Yes, ma'am.
Okay, that's what I thought. And we did not have a quorum last meeting, or we did? Were we able to do the minutes from January? I'm sorry, from last.
Give me just a moment and I will tell you.
Thank you.
You're welcome. Flip through my binder here. Kelly, did you by chance handle the February meeting? I don't have notes.
Yeah, I'm trying to find them. If you'll give me just a second, I'll probably be able to get them.
Yeah, it was the January meeting.
Oh, January. My apologies.
That's okay.
I'm looking in the wrong month. That could be why I can't find it.
So
yeah, it looks like you did not have a quorum.
Okay. So when we do have a quorum, we will have to approve, we'll have to vote on approval of the minutes from November 23 and January 24, correct?
Yes, ma'am.
All right. Well, thank you all for being here. We do not have a quorum, so we will move on through the agenda. If any of the other TAC members join, we will go back and look at the minutes for the November meeting and the January meeting.
Excuse me, this is Kelly again. I'm so sorry to interrupt. You did not have a quorum at the beginning of the meeting, but then you had a quorum later. So those minutes did get approved.
Okay, thank you. Okay, so if we have someone join, we will just have to go through and approve the January minutes. Okay. Let's go to old business. We have a report on school-based services.
And I believe we
Hi.
have someone on. Oh, my apologies. Go
I'm
ahead.
so sorry about that. Let me see if I can manage to share my screen here. Okay, so it's saying that I can't share my screen. So I will go ahead and get started on that.
Try again, Annette.
Okay.
I had made you a co-host when you came in, but sometimes it jumps, and so there may be a random person in the meeting that's a co-host.
Oh, okay, gotcha. Okay, can you see the screen? Okay, good. All right. What I've done is I have compiled some numbers for you. let's see. So I think I may have said this last time, but school districts, we have 171. But only 168 participate in school-based services, and 58 is in expanded access. So with that being said, in the school districts, under the no free care, only 165 school districts billed, and that's out of 171, and only 49 billed, and that was out a total of 58. Also, here are some of the numbers. I particularly like this graph because you could actually see the numbers in and you know how it's ranked and stuff. If you notice at the top, it's broken down into quarters. So you can see how each one of them, like mental health, speech language, audiology, occupational therapy. I do notice that, you know, that the speech and language is, you know, quite a bit through the January. The numbers really, you know, kind of surprised me when looking at these. We had nothing in medical and a few in interpreters. So, but you'll have access to all of this. Let's see. And then here is the free care expanded access. So you can see that the nursing services, it's also broken down into quarters as well. And you can see that the nursing services are, you know, quite a bit through the year. So,
Annette, can I ask the difference between the behavioral health column and the therapy column, just the plain therapy?
well, that's how it was broken down. It just said therapy. What I was assuming, and you know, I shouldn't assume, but therapies is what I thought about was physical therapy because they had occupational therapy, but they didn't have physical therapy.
I wondered if that's what that meant. They just did not put the word. Okay.
Yeah, I will look into that though. Let me just make a note of that. All right. So, and then you can see that, you know, transportation, assistant technology, and interpreter. It kind of puzzled me on as to why, you know, none of those were used, but that's free care because if they have to have a certain, you know, certain type of transportation or technology or something, then, you know, they would be on the no free care. So let's see. So the billed quantities for no free care was 2,461,490, whereas you can see expanded access was only 48,022. And that kind of gives a rundown on that on my part. I do know that my branch manager asked me to speak on the parental consent. And however, it can't be combined because this is a special education document that was approved by special education and the legal team that's mandated by the federal level Department of Education. So those can't be condensed into one or combined. Now, and then two, let me see here if I can figure this out again. If I can change the screens here. Just be a little patient with me here. Okay.
While you're doing that, can I ask a quick question? I
Please.
assume that the free care, based on some of the things I saw, are children
Yes,
with
ma'am.
special health care needs. Is that correct?
Now, wait, which one now? I'm sorry.
The free care, is that or there was one where you didn't have any medical? And that I think was the free care. Is that right?
Wait just one moment and let me see if I can go back here.
And Donna, while she's looking, I wanted to let you know Alicia has joined us. You now have a
Okay.
quorum.
Okay, thank you.
That is, no free care.
Okay.
Yes, ma'am. I was trying to see if this will work. I'm trying to change this here. And this, the one I was getting ready to do was the one for our survey. Well, shoot. Okay. I apologize for this.
Annette, this is Erica. I'm on. I don't mind to cover it.
Oh, okay. I just hit it. I'm sorry. You want me to take it off for you?
No, that's fine. If you'll just leave that up.
Sure.
So we sent a survey out to all of our school districts. We did not get the response we had anticipated. We think that's due to several other organizations also sending out similar themed surveys at the same time. But we did get enough responses to give us some guidance of what our next step should be. One of the first things we asked was what their role was within their school district. And we had several options listed of what we had intended to be our respondents. But once we sent out the survey, there were a lot of just individual providers that we found wanted to participate. And that wasn't one of the roles we had listed. So we're not really sure where they may have chosen what their role was. We would assume under the Medicaid administrative staff. And if you will go to the next question, Annette.
Sure.
And so when we asked them if their district was enrolled in expanded access, 1/3 of them indicated that they didn't know. So that lets us know right at the beginning that we need to put more education out on what expanded access is so that school districts are aware of all of the benefits of offering that within their district. And if you want to keep going, Annette.
There you go.
We did ask them if they offered certain nursing services, and if they did not offer those services, if they were interested in learning more. And the one that had the highest response rate was for immunizations, that districts did ask to hear more information about that. And we think that's because so many children maybe are not starting the school year completely up to date on their immunizations. And if there's a way for us to assist them in getting those immunizations to the children. So we will definitely provide more guidance on that as well. And oftentimes those are going to be interest in after hours school clinics or weekend clinics. And that is something we're discussing internally too, how those could be covered under school-based services. We did ask if they were contracting any of the services with other providers to let us know what those provider types are. And we were able to find that that there isn't a straightforward way or a dominant way services are being delivered in Kentucky schools. Some schools are hiring all of the staff and then billing for the services those staff do. Some are contracting with the staff and allowing those contracted providers to do the billing. And then others are contracting with other providers and then paying them a certain amount, but the schools are still doing the billing. So there's a different ways, and we have identified that we need to provide more guidance for the school districts on the different options that they have for delivering services, and that way they can decide which is the best method of delivering those services for their school district. And you can keep going, Annette. I think there was one more point I wanted to highlight. Yeah, keep going through that one. You can keep going. I think it's going to be, we did include, just keep going, and you can go through that one. I think it's the one on the competencies, self-assessment. Okay, so here is where sorry, Annette, go back up just a little
Oh,
bit.
I'm sorry.
Right here. So we did do a competency self-assessment. We asked them how where they would grade themselves as far as their knowledge and skill for different issues. We have our federal and state regulations are in there. Also how to document student medical records. But one thing that stood out for all of these was the covered services under expanded access. That was the one that had the lowest rating of respondents feeling comfortable with that information. So again, we know that we need to provide more information on what expanded access, what that is, and all of the different services that are covered under that. The other was the cost reimbursement and cost settlement. That is something that can be, I won't say it's confusing. It's a lot of information to take in because we do the reimbursement differently for school-based services than how it is for most other provider types. We allow them to do interim claims. So we give them some funding to help them maintain throughout the school year. And then at the end of the school year, we do the cost settlement. We try to make sure that those interim claims are sufficient enough that at the end of the school year during cost settlement, schools will not have to pay a significant amount if they were overpaid. And also so that they're not paid a significant amount over if they had been underpaid throughout the school year. We want to make sure that they have that cash flow basically to sustain them throughout the school year. But it is a different process. So we will make sure that that is explained a bit more to our school districts as well. And if you want to keep scrolling now, I'm not sure if there's much more highlights or not.
Keep on going.
Yeah, keep on going. And then we did ask a couple of questions. If they were already participating in expanded access, we asked them if they had experienced any barriers. And you see that staff turnover is the high one, and we anticipated that. And also provider shortage. But for staff turnover, knowing that, we know that we need to get more training out there, and that training has to be something that's easily digestible because, you know, if they are going to have a new administrative person to take over, you know, doing their billing, we don't want it to be something that's going to be super intensive, that's going to take them, you know, months and months to learn or to pick up. Because that's just going to contribute to more staff turnover if it's such a tedious job to take on. So all of our training materials we're reviewing to make sure that they are, again, easily understood, easily digestible, and can help facilitate implementing expanded access rather than being a burden themselves. And if you could go to the next question, I think it's the last. And if they hadn't enrolled in expanded access, we asked them why they had not. And you see there's various reasons there. And one of those, again, the highest on there was unfamiliarity with expanded access. So we do know that we need to get a lot more training materials out that explain what it is and how beneficial it is, because it's not just covering, you know, medical services, it's also those very important behavioral health services as well. And that is the end of that needs assessment survey that went out in February. We gave them 30 days to complete that. And again, we didn't get the response, the number of responses we had anticipated, but we did have over 40 different school districts give us complete survey results.
Okay, thank you. And perhaps I'm the only one that doesn't understand this fully, but could you explain a little bit more? And if everyone else knows this, and then I'll just get the information offline, but Can you explain a little bit more about the expanded services that you're kind of referring to and kind of, what children that involves and things like that?
Sure, certainly. So when school-based Medicaid services first began, it was just for those students that had an individualized education plan, the IEP. And so those students, schools could bill for any medically necessary service that was offered to those students. But that caveat was they had to have an IEP. It had to be listed in their IEP. In 2014, CMS reversed a decision that they had. So it became, I guess the moniker was free care, but we call it expanded access. And it was expanding the access to any child that was enrolled in Medicaid. So any medically necessary service that was offered to a child in the school could be covered, and that was the expanded access. So schools can bill Medicaid for nursing services, behavioral health services, speech therapy, occupational therapy, physical therapy for any child that has Medicaid, and they don't have to have an IEP. So that's what separates it. So there's the IEP services where they're documented that the child has that medical need. And then there's the expanded access, and this is for any child that has Medicaid, regardless of having an IEP or not. As well, in order to be covered under the expanded access, those services have to be offered to the entire student body at no cost. So schools aren't able to say, we're going to offer this service just for those children that have Medicaid, knowing that they'll be reimbursed. They have to offer that service to all of the students. And so implementing expanded access in schools benefits the entire student body as a whole as well. It's making sure that those services are offered to all students, regardless of payer source. I hope that explains it.
Yes, thank you very much. That
You're
was
welcome.
very helpful. Does anyone have any other questions about the presentation?
I have one question. I joined just a couple minutes late, so I apologize if this maybe was covered at the very beginning. But when I was looking at the service categories that you had outlined from some of the data that you showed, one category I didn't notice on there was anything related to oral health. Is that not a reimbursable service, or is it just not something you're tracking?
I believe it may be captured. It is something that we cover. We cover dental screenings and fluoride varnish. It may be covered under nursing services because that's generally where it is categorized. But we can pull that data separately if you wanted to see just the oral health numbers. We can do that.
Okay, thank you for that. I was just curious.
You're welcome.
Any other questions or comments? Thank you again. That was helpful. And Alicia, thank you for asking the question about oral health. It occurred to me when I was looking at it, and then when it came to the end, I forgot to ask about it. So thank you for bringing that up. Since we do now have a quorum, I would like to go back to the approval of the minutes from the January 2024 meeting. Do I have a motion to approve the minutes?
I motion it.
And do I have
I'll
a second?
second.
Thank you.
I'll second.
And all in favor? Aye.
Aye.
Okay. All right. Thank you for that. Now we'll go back to old business. We are asking for a report on obesity prevention, treatment, and services for our next meeting in July. And we're asking from information from DMS and the MCOs. So, guys, are you still okay with presenting that in July?
We can send that request out to all the MCOs after this meeting. Can would someone be able to give me a little more specifics in writing exactly what data it is, or is there anything in particular you want to see? Is there a time frame? Those types of things. Like,
Yeah, and maybe we can, you know, certainly I would like to see kind of what kind of services, what data the MCOs are tracking in terms of BMIs or, you know, in the different age groups. And what services are they, you know, providing nutritional services, or any reimbursement for physical activity devices or aids or things like that.
okay, I will send out a request to all the MCOs and have them do a 5-minute presentation in July, and then we'll also follow up with DMS on our side. Thank you.
Any of the other TAC members have any additional information that you're interested in regarding obesity prevention treatment? Okay. Under new business, oral health emergency care, OR delays. I feel like that someone brought this up as an issue last time, but I don't recall.
Yeah, I had just mentioned that I had outreach from a pediatrician about some issues that were happening with this. So I think we were maybe considering slating it for a future meeting as a topic. I'm not sure if there's anything we need to do with that today, but yeah.
And maybe that's something that makes sense for our October meeting. That would give us a while to collect data. And hopefully we could reach out to our colleague. I think we have a representative from the
You
dental
do.
society.
One of your Amandas.
Mhm.
You have two Amandas. One of them is a dental representative.
So perhaps maybe we can reach out
Yeah, that makes sense.
to her as well. Okay, we are flying through this agenda. So please feel free to, if anyone has any comments or questions as we move through. Again, looking at future topics, perhaps the oral health issues can be one of our topics for September. We also talked about juvenile justice and bullying kinds of issues. I don't know if that's something, I know I think we have a new commissioner of juvenile justice, is that correct? Was someone just recently named? I'm just making that up. Could be. Okay. I can certainly reach out and check on that, and maybe that's a topic of for future meetings. Are there any other topics that the TAC members feel are important to address at either the next meeting or the meeting in September? Any topics that the MCOs or DMS think might be important for us to know? Any changes, anything that will be changing that you feel like might be important for us to know from your standpoint?
This is Stuart on with WellCare. Nothing changing, but immunizations. We're all the MCOs are trying to drive that, really improve those. It's kind of like all hands on deck for Kentucky. So just a reminder, I guess.
Okay. Well, and maybe, you know, maybe that's a topic to look at what barriers and what potential solutions you guys are working through, what kind of barriers you're seeing, what kind of possible interventions. I know at UK with our mobile clinic, I know some of the MCOs have reached out about, would this be a mechanism for getting vaccinations or immunizations into areas where that may be problematic for patients and families?
Yeah, and I mean, I know all the MSOs, we're trying and just to be candid, COVID vaccine hesitancy has spilled over, and I think it's even happening nationally. Like we're seeing measles outbreaks. There's just, and we've definitely seen like younger female parents in particular, just that hesitancy to get their child vaccinated, that's actually become a thing now. And I think it's directly tied to the COVID-19 vax, whatever misinformation or whatever you want to call it. That's a huge challenge for all of us.
Adam, you have your hand up. Would you like to?
Hey, yeah, this is Dr. Adam Rich at UHC. I just want to say you were asking what MCOs are doing in addition to, and I don't want to belittle the vaccine thing at all, because that's critical, and we're all facing our challenges with that. And I think you guys were right on point. But we're also all under a oral health, children's oral health performance improvement project. So all the MCOs will be working to get more access to preventive services for kids and new. Trying to be creative and find ways to get more members in to be seen earlier. So it's based on sealants and fluoride varnish, which we know can be provided by physicians, clinics, and health departments, as well as school-based clinics and dental offices. So we're just looking at all the avenues we can do to try to improve access for and pediatric preventive services. Thanks.
Thank you.
And so that may tie in September, because at that point a lot of people have their plans submitted, and we should all be rolling along with a program at that time.
Okay. Any other comments, questions?
We have a couple hand raised. I see Anthem and one other.
Yes.
Hi, Danielle Rochier's Anthem. I just wanted to throw our support behind that. Yes, we're all working on the vaccines as well as just in general preventative visits. I will say that DMS and some of the MCOs helped work on a vaccine survey that just went out. So you mentioned the barriers. I know Dr. Terrio has that information currently and she's combing through it. So that might be interesting to kind of bring here and discuss those barriers. We surveyed as many vaccinators across the state who are willing to complete the survey. And I've seen some preliminary results, and it's pretty interesting and eye-opening. Some of the vaccine hesitancy even amongst the pediatricians and other vaccinators in the state. So I think working on that would be a great thing for this group.
Okay. So perhaps that may be a topic for a future meeting, either as a second topic in July or a second topic in September.
Yeah, I think that'd be terrific.
What do you guys think in terms of getting data together?
I know Dr. Terrio is going through it right now, and I think she's going to have it soon. She's going to do another presentation to those of us who worked on that survey. So it should be soon. I think that they'll have that information available.
Okay, so perhaps a second topic for July might be to be able to review that immunization survey, and then perhaps a follow-up to that at the September meeting.
Yeah, sorry, I didn't mean to cut you off. Yeah, I can mention that to Dr. Terrio that would be an interest for this group.
We can also send that in our follow-up email.
Okay, thank you.
Heather has her hand raised.
Heather, yes.
Sorry, Donna.
No, that's okay. I just saw it at the same time you did.
This is Heather Hayhill with WellCare. I would like to piggyback off on the preventative health related to adolescents. So looking at that age group between 12 and 21, so that difficult getting those annual wellness visits, in particular the teenage to 20, they're really challenging. And with the the VBP that the MCOs are faced with this year and next year, we're really focused on the pediatric and how can we improve and increase the members that are just not getting those annual wellness visits, so that finding ways where we can strategize that amongst the how can we improve that. So I think that's um, a struggle that all of us face, all the MCOs face in that age group, can be very challenging. So I think that would also be an interest.
Thank you. Perhaps that will be another topic, or that's a topic that we can tie in, or a secondary topic, maybe for the the September meeting. Are any other thoughts? I'm looking for hands and I don't see any other hands raised. Okay. Under recommendations, any of the members feel like anything we heard today should contain a recommendation for the MAC?
I'm not sure that we specifically talked about this today, but it's related to the Medicaid in schools, the services that are provided. And maybe somebody from DMS could clarify if this is still a barrier, but I have previously heard of some concerns that there was a restriction on services were only Medicaid billable in schools if they were happening during school hours. And so if schools were offering, like, for instance, an event where they had vaccines after school or like during an event outside of school hours, that those were not reimbursable. Is that still a barrier? And if so, is that something that could be part of a recommendation to allow for those services to be billed outside school hours? Does anyone from DMS know if that's still happening?
It is. That is something that we are discussing internally. But as of right now, we have to do it within school hours.
Would it be helpful if we made a recommendation to the MAC that be kind of reevaluated, or it sounds like you guys are already evaluating that?
Yes, ma'am.
Are there federal guidelines that need to that are causing this, or is this really a state issue?
At this moment, I am not 100% sure, because I am relatively new to this position. So, what I have been taught is that is we stay within, the school hours. So I'm still trying to learn about it, and that's also one of the reasons that we're looking into it.
Hi, this is Justin Derringer. I wanted to speak on that real quick. That is a topic that we are researching currently. We have some time scheduled with federal Medicaid, CMS, just to make sure that we have everything that we need to have in place. There's a lot of moving parts on that particular request, so we have to. There's a lot of research that's being done currently, a lot of research that has been done, and a lot of research that we're doing currently to kind of come up with a solution to that issue and see what we can kind of come up with. So we are currently actively working on that project. Again, like I said, there's a lot of moving parts, but we're currently working on that.
Okay, good. Thank you. So maybe a follow-up when we meet next, just to see if there's any update on movement with that issue.
Yep,
sounds
we'd
good.
love to we would love to come on next meeting, give you updates on that project.
Okay, thank you.
So yeah, probably then not a formal recommendation is needed if they're already working on it, but I appreciate the update on that and we look forward to hearing from you all. Thanks.
Okay. All right, any other comments, questions, needed clarifications? MAC meeting representation, when is the MAC meeting?
May 23rd.
And that is still on a Thursday?
Yes, but it now starts at 9:30.
All right. Our next meeting is July the 10th from 2 to 4. And if folks, if our TAC members will stay on the call, we can work on July the 10th's agenda. Any other comments, questions from any of the MCOs before we move to adjourn? This might be a world record short meeting. So you all are getting the gift of time, I believe, today. Thank you all for being here. If anyone has anything else, please feel free to speak up or put it in the chat. But otherwise, I will. Oh, during heat season, that's definitely a gift. Yes, I think during any season, I have to be honest. But thank you all for being here. And if the TAC members will stay, and Aaron, if you will stay,
Okay.
we will. Yes.
Thank you. We were just going to say thank you.
Oh, okay. Thank you
Thank
all.
you.
We will see you in July.
Okay. Take care.
Thank you all.
Good day.
Have a good afternoon. Thank you.